Today I would like to talk about a disease in hematology which is known as multiple myeloma. It is basically a disease of the elderly, more common in people who are more than 50 years of age, and the incidence increases as the age progresses. We find it more commonly in the age group of 60 to 70 years. So basically, how do the patients present to us? Moreover, we are seeing these patients with few of the complications of multiple myeloma. These complications are, most common is anemia. Whenever the hemoglobin falls in an elderly, there is a suspicion of multiple myeloma. Another frequent complication is increase in serum calcium levels. So if there is increase in serum calcium level, we suspect multiple myeloma. A very important complication is bone fractures. There are multiple lytic lesions in multiple myeloma. It can be in the spine, can be humerus, radius, scapula, or any bone. So these patients present with fractures, spontaneous fractures, pathological fractures, bone pain. So these bone pain should not be ignored because these can be a sign of multiple myeloma. Another common feature is renal failure. Patients present with increase in serum creatinine levels. This can also be attributable to multiple myeloma. So whenever these four symptoms, that is anemia, renal failure, increase in calcium level, or bony pain or fracture in the bones occurs, you have to consult a hematologist to rule out multiple myeloma. Once the diagnosis is made after doing the bone marrow and we can demonstrate an increase in plasma cells in the bone marrow, we need to make a staging. Either it can be stage 1, 2 or 3, but the treatment is there. So there is nothing to worry about multiple myeloma treatment part. With chemotherapy, the disease can be controlled very nicely. It can be controlled very nicely, and there is a role of autologous transplant in multiple myeloma. With that treatment, with chemotherapy and transplant, the patients can live nearly about their normal lifespan. So there is nothing to worry. Just if you have a suspicion, just consult a hematologist. Once the diagnosis is made, there is options of chemotherapy. This can be taken in daycare basis, can be taken at home also. It's very easy nowadays. So there is nothing to worry. It's almost controllable and almost curable. Thank you. Thank you so much.